introduce myself. My name is Kristie Isaac. I'm a registered nurse and also the co-owner of IVme, Wellness and Performance. And 4 years ago, I kept debating on how I should do this. Should I just come and talk about all the stuff that we do? And I thought, no, I kind of want to share with you all how I got to where I am. About 4 years ago, I had a pretty serious health crisis, and it brought me to my knees. And it was like nature's way of saying, that's enough. You've got to take a break and you've got to take care of yourself. And it really changed everything, and it really forced me to reevaluate everything in my life. And I had to get out of emergency. I was in ER for 20 years, and I had to get out of emergency and really just make some changes. Next slide. So I'm embarrassed of this picture. It's blank, but it's not showing up for some reason. There we go. Okay, this picture, I still shudder every time I see it. It's pretty shocking to me. This was 10 years ago. Okay, this isn't the 4 years ago thing, but 10 years ago, I was, I'm smiling in this picture, but I was the unhealthiest I'd ever been in my life, screaming on the inside. I was 100 pounds heavier, and I'm only 5'2", so, the Fat Albert song would start playing when I would walk into a room. So I'm short, and it was tough. I was working 60 hours a week. I was going to school to finish my bachelor's, single mom, second divorce, horrible diet. I'd go to the doctor and I'd say, check me, something's wrong with me. I've gained all this weight. Something's not right. They'd check everything. You're fine. And I'd okay. Kept going back to the doctor. You're fine. Your thyroid's normal. Everything's fine. You're fine. And then they start saying, oh, better send her to a psychiatrist. Then I did go see a psychiatrist. And, the first thing is, well, you're going through a divorce. You're stressed. You're anxious. And here's a prescription. Okay. It's kind of a Band-Aid, really. Granted, I was, going through a lot, but then you get started on the antidepressant. 20 million Americans are on antidepressants, and that's crazy. That's staggering. So then after my first prescription, go back in, well, I'm having all these side effects. I have no energy. I'm tired, and I have no sex drive. And, well, here you go. Here's another prescription. Okay, now I got 2 prescriptions. Time goes on, gain more weight, go back in. Well, now I can't sleep. Well, here's another prescription. So 3 prescriptions and 100 pounds later, and still being told you're fine, I started researching everything I could find. I'm like, something is not right. And I just kept researching and trying different doctors, and I finally found this amazing doctor in St. Louis. Her name's Kathy Maupin. I have a lot of reading material if any of you are interested afterwards. Sometimes you just have to kind of take your health in your own hands. It's not doctors, they mean well, but it's how they're trained. They're trained to treat people when they're sick, not keep people from getting sick. And it's just prescriptions. Oh my gosh. That's like one of my pet peeves. And can anyone, when you're looking at this picture, the next slide, please. When you look at this picture, can anybody, raise your hand if anyone can relate to this picture. You're juggling so many things at once, right? I mean, I don't even have to tell you. And of course, busy moms, women in general, we always end up last on our to-do list. That's what happened to me. And I just want to talk to you ladies about this because I don't want it to happen to you. So I got the idea that I've got to get the word out to women and I want to help women not go through what I did and go through the years of struggling and going from doctor to doctor and kind of just putting a Band-Aid on the underlying issues. So another thing was, as I preached, I'm supposed to be a nurse, I'm supposed to be healthy, and I was like one of the most unhealthy people. And, I preached about self-care and taking care of yourself, but I didn't really believe it for myself because I thought, well, I'm a nurse, I can handle it, But the truth was I really couldn't. Next slide, please. So after I got the idea of helping, I'm like, I got to bring this to women. And, I found the amazing doctor in St. Louis. I was driving 3 hours south to see her every 3-4 months. And I'm like, I got to bring this to Central Illinois. There's so many women that could benefit from this. And I started, about 3 years ago, I talked to local business owners and doctors. And as I'm reflecting last night, as I'm preparing, I'm like, I cannot believe how many no's. I counted. I had 14 just reaching out, I want to bring this anti-aging clinic and help women of all ages be able to afford, to look and feel their best. Nope. 13 no's. Really discouraged. And there were so many times when I look back, I was about to give up. I was like, it's just not meant to be. And I was like signing up to go back to school. I'm like, I give up. And then the right door opened. And I met, as I'm searching, I'm trying to find the right partners. I even had a couple of false starts with different doctors that I thought I was going to partner with, and then they didn't have the right knowledge, or they didn't have the same vision as I did. And then I met this amazing group of people as in my search at IVme in Chicago. They had everything on their menu that I wanted to provide for everyone here. So believe it or not, it's kind of funny. I reached out to one of the co-founders on Facebook, and he didn't answer me for 2 months, and I thought he probably thinks I'm some kind of like weird stalker person or something. Didn't answer me. I thought, all right, I already had opened anti-aging and IV bar on my own with another doctor. It just wasn't going well. And you can only do so much as a nurse. You have to have a doctor. You have to have a medical director. And so I said, all right, I'm going to try one more time. So I tried one more time, and he said, oh, I'm sorry, I missed your message. Absolutely, come up and let's talk. And from that point on, it was just amazing. This group of people, and doctors and nurses working together, and they formed a company in 2012. So it's not, it's not new. It's been going on in Chicago. This kind of health, prevention and functional medicine kind of view has been going on in the West Coast for years. But us in the Midwest, we're kind of 10 years behind everything. But we finally got it here, guys. So finally, in 2018, next slide, we partnered with IVme, and this is Dr. Jack, and I don't know, on my slide it's white, sorry. On my slide it's white, it's okay, it's not that important. On that slide, I was just talking about Dr. Jack. Dr. Jack Dybis is the founder of IVme, and he wants people to look at health differently and not just put Band-Aids on things and treat the underlying cause and not, be on so many prescriptions. And now we have 3 locations. So we have 2 locations in Chicago, and Champaign is our next location. And we are actually hoping to partner with him and help him go nationwide. So this is like our first step, and I'm so happy to be a part of it. So in 2018, I started talking with the IVme people in February, and then in June, officially opened as IVme Wellness and Performance at 2520 Village Green Place, next door to Rod Sickler Salon and Spa. Do you guys heard of Rod Sickler, right? So we're right next door to him. And I love their tagline, it's changing the way you think about health, and that's really what it is. There's so much information I want to give you guys about each area of health, but I only have 5 minutes, and I'm probably over already. So I want to invite you guys. I have lots of ways that I want to give you more information, so I'm trying to keep it short. You can go to the next slide. So I talked with you about my personal health journey, and what I really want you to take away from that is that you saw my rock bottom, but we all share the same struggles, trying to balance everything, trying to stay healthy. And, I still struggle. It's still a daily struggle to keep everything balanced and always put my health first. Next slide. I'm over halfway done, guys. Hang in there. So, according to a survey in by Statista.com, in 2016, patients between 50 to 64 years of age had an average of 19.2 prescriptions per person. To me, that's staggering. I had 3. I had probably 5 or 6 myself. So it's just a staggering statistics. So you would think prescription drug use is going up. Shouldn't we be healthier as a nation? No. The health is going down and prescriptions are going up. It doesn't make sense. Something's got to change. So now diabetes, cancer, Alzheimer's, obesity, and heart disease are all on the rise. So this should be a wake-up call that we need to change. The next slide is a picture of me and my sister, and it was taken last weekend, and forced myself to get away. And I just want to keep telling you guys, make yourself a priority. I'm 50 years old. I'm the mother of a 30-year-old daughter, a 13-year-old son, and a grandmother of a 10-year-old, 100 pounds lighter, more energetic, achieving more in life than I ever have, happier and healthier. And, health is like laundry. It's never really done. It's a constant struggle, and I'm just so blessed to have the partners at IVme. All right, guys, almost done. We're on the what can we do to help you slide. So bioidentical hormone optimization, medical weight loss, we have lab work, we have nutrition, testing and support, disease screening. We have a guy that's coming on, he's a nutritionist, and he can analyze your DNA and tell you what diet you should be on. We have vitamin and mineral IV therapy. Is anybody a fan of the Housewives? Anybody? Come on. No Housewife fans? Okay. Well, if Housewives, one of the Housewives, Siggy, she has very televised emotional roller coasters, and she used bioidentical hormone therapy to help balance her emotions out. When I say bioidentical hormone therapy, you can go to the next one. What's the first thing you guys think of? Just blurt something out, anything that you think of. What's the first thing that comes to your mind? What's that? I didn't hear you. Scam. Oh, wow. I haven't heard that one before. Okay. Well, hey, she's being honest. So that's the first one. So usually what I hear is, well, hormones cause cancer, right? So that's actually not the case. I've been a bioidentical hormone patient for the last 4 years. It changed my life. It really did. I know there are some scams out there. I'm sure there are. But we're definitely in this to help people. And some of the myths, about hormones is that they cause cancer. They do not cause cancer. And if you replace your hormones, you won't grow a beard and sound like a man. I've been doing this for the past 4 years. There's now 1 million BHRT patients in America. So my mission now in life is to dispel the myths, to educate the public on outdated research and help other people change their lives. The whole hormone optimization area there's so much information. There's no possible way I could ever fit it into this. That's a whole day of presentation in itself. But we are going to be doing a seminar about that, and I'll tell you more about that in a minute. So at IVme, we love to create an individualized plan. We start out drawing blood work, and Dr. Jack will sit down with you and spend an hour going through each and every result, and we come up with a plan based on how you feel and your lab results and what we can do to help you. We create a plan. In this plan, CDC estimates that 70% or more of Americans live in a state of chronic dehydration. Well, no wonder everyone's so unhealthy. So not only do we have hormones, we have different IV vitamins and shots. We have hangover IVs, migraines, allergy, wellness and vitality, cold and flu, jet lag, and even beauty IVs if you're getting ready for a special red carpet event. You know how when you're on, what's that? Yes, exactly. You'll glow from the inside out. It's what the Hollywood stars do before the red carpet events. So I'm kind of extending a challenge and asking you all to join the revolution, to put yourself at the top of the priority list instead of the bottom, and take care of your health. And you know how when you go on the airplane and the stewardess is doing their demo and they always say, put your mask on first. And that's really what you're doing, is you're putting your mask on first so that you can be able to help other people put theirs on. That's the most important thing I want you to remember of everything tonight, is just please always take care of yourself first. Okay, so going over, if you stop over at this table and give us your email address, we will give you a card for a free B12 injection. B12 shots regularly can help regulate sleep, increase your energy, and decrease your appetite. We're also doing a drawing. So if you enter your email address, we're doing a drawing for a free beauty IV. It's worth $190. So not all the beauty IVs don't cost that much, but this is like a deluxe treatment. It's got vitamin C, biotin, glutathione, all the good stuff. And so on December 1st, we're having a grand opening party. We have invitations to that if you would like to come and join us for that. On December 4th, we're having, and I can give you more information about all this over at the table. On December 4th, we are also having a BioT seminar where you can find out more about hormones, and we're doing free lab work for the first 20 people that sign up. So that's a good thing. Yeah, that's...
Like tonight, like we throwing elbows to get...
Yeah. If we have 20 people sign up for that, I will make it happen for you guys. I will. Next one. So I just want to leave you with this quote. If you love your work, you'll be out there every day trying to do it the best you possibly can. And pretty soon, everybody around you will catch the passion from you like a fever. And I hope that's what to do, is inspire everyone to take care of themselves. Thank you, Jennifer, Leah, and the Junior League. And thank you all for listening.